Long COVID, who has the highest risk of developing post-COVID symptoms? 1. Long COVID is the newest problem puzzling people more than COVID-19 recovery. Developing long COVID is the new looming fear disturbing patients. From anxiety, persisting cough, breathlessness, dreary fatigue, insomnia to degraded quality of life, COVID long haulers are coming forward and sharing their painful experiences. So much so, many post-COVID clinics have also opened in cities. All this because there are people who go on to experience symptoms of the disease 4 to 5 months after recovering from it too. Recovering from COVID-19 can depend on these factors. While COVID recovery requires utmost care and importance, lingering symptoms of post-COVID can depend on a lot of factors from your age, treatment and severity of the infection. Newer studies have also thrown light that even though anybody can get post-COVID, some are more likely to suffer from severe symptoms than others. 3. A study by King's College, London, which based its survey on the symptoms entered by recovered patients on a COVID symptom study app, found that while long COVID can strike anyone, there are certain factors which increase the risk of long-lasting consequences. It was also observed, according to the study, that 1 in 20 people complained of severe side effects post-undergoing COVID and 1 in 7 complained of feeling ill for up to 4 weeks. 4. Why does long COVID happen? SARS-CoV-2 virus can not just attack your respiratory system, but also impact the vital functioning of the body, which could leave long-lasting impacts on your health. Even after making a successful recovery from the infection, the virus can continue to linger and deposit in the body for a long time. In its most infectious stage, the virus also destabilizes your immune response, which could be one of the reasons why your body can take such a long time to really recover from the virus. 5. What qualifies as long COVID? While there is no clear distinction for long COVID, experts suggest that recovered patients who experience 5 or more symptoms in the first week post-testing negative are much more likely to be long haulers. According to recent findings, here are 3 particular factors which can raise the risk for long COVID. 6. Those with underlying respiratory conditions. While no pre-existing medical problems have been flagged with a higher long COVID risk, it was observed that those patients who had a higher risk of respiratory problems, lung infections, face a higher risk of suffering post-virus symptoms. It should be noted that COVID-19 causing virus is primarily a respiratory germ, and causes the most severe damage to the respiratory tract by scarring the linings and impairing functioning as well in some cases. For the same reason, breathlessness, lingering cough remain to be some of the most commonly reported post-COVID symptoms weeks after the viral load clears away. 7. Old age senior citizens remain to be one of the most vulnerable categories to face a high COVID-19 infection risk, and mortality rate as well. Frail, or diminishing immunity, and the likelihood of developing comorbidities also consequently slow down the recovery time. Hence, those over 55 can have a longer battle dealing with COVID symptoms, with fatigue, body ache, brain fog and breathlessness being the most common ones. 8. Females' gender also has a role in influencing your COVID outcome. While men face a higher risk of developing severe illness and mortality, females, unfortunately, face a higher risk of suffering from post-COVID syndrome. According to studies, women of all ages were more likely to suffer from symptoms like hair loss, fatigue, impaired sense of smell or taste and brain fog. Past studies out of Italy also predicted that COVID plus women had a higher risk of developing mental health problems, including anxiety, stress and post-traumatic stress disorder, PTSD. 9. Obesity and unmanaged weight lower the body's metabolism. Increased inflammation can also spike the risk of developing comorbidities, prolong recovery and make patients continue to experience lingering symptoms for months at a stretch. Hence, it's crucial that any extra weight is controlled in a holistic manner. Please save the trees and nature. Please subscribe to our channel. Thank you.